Guys, did you guys know that infant mortality in the United States is 6 deaths per 1,000 live births? That's 26th among developed nations.
Whoa, wait. What even is infant mortality?
Yeah, I don't understand the connection. They're infants, we're adults. What is this?
Yeah, infant mortality doesn't seem like a big problem. Seems pretty easy to fix to me.
No, guys, this is a big deal. I know what we're gonna do.
What?
We're gonna have a TED Talk.
So we're here today to talk to you about infant mortality, just something that's not always easy to talk about, but we're excited about it because there's a lot of hope and a lot of potential to make a great impact. So our intervention is called Babies on Board, and it is a mobile health clinic addressing infant mortality in Holmes County, Mississippi. Infant mortality is defined as the death of a baby before its first birthday. In the United States, the rate is currently 6 infant deaths per 1,000 live births, placing it 26th among developed nations. In Mississippi, the rate is 9.3 infant deaths per 1,000 live births, with rates twice as high among African Americans. In Holmes County, the infant mortality rate is 14 per 1,000 live births for the year 2015. So there are a number of factors impacting the health and quality of life of the residents of Holmes County. They, on the whole, have high rates of cardiovascular disease, stroke, and diabetes, very low educational attainment, and there are significant disparities between African American and Caucasian residents. And so all of these things, like access to healthcare, education, jobs, and their neighborhood and housing conditions, impact healthy birth and development of their children. So what are some of the risk factors for infant mortality? We know that things like premature birth, low birth weight, and safe sleep practices are important, in addition to the mother's preconception and prenatal health and her chronic disease management. So Babies on Board is going to focus primarily on the enabling factors related to early and adequate prenatal care. And we're going to be doing that by bringing the care to the women in order to improve accessibility as well as affordability. We're going to link them to insurance if necessary and other social services, as well as educate them about their preconception, prenatal, and pregnancy health. And we will be doing all of this while addressing the interpersonal and community level in Holmes County.
Hi guys, welcome to the Babies on Board van. So come on in and I'll show you what the intervention's all about. So the goal of our intervention is to have adequate prenatal care. So that means 10 to 15 visits during the course of a woman's pregnancy. How we're going to do that? 5 locations in Holmes County to provide the space, childcare, and also be promoting our prenatal services. So the first step, well, they're going to come in, check in with the medical assistant, make sure everything is good with paperwork and stuff like that. The second, probably most important step, is they're going to be meeting with the nurse practitioner and, doing ultrasounds, checking sure the baby and the woman are okay, and also referring high-risk referrals. The next step that we're going to have is each time a woman comes into their visit, they're going to meet with a social worker. There, they're going to go over their coverage, connection to welfare programs, mental health services, and make sure that they're covered in those ways. And then the last step that they're going to have is they're going to meet with the program director. The program director has all of these topics that they're going to be talking about, and those could range from how to deal with chronic disease during pregnancy. It's also breastfeeding, how to make sure your baby is okay, stuff like that. Mobile health clinics work. While they may be more expensive, the quality of life and care that are given to these people in more rural areas is outweighing that financial capacity.
So are you ready for some theories? So what theories are we using in our intervention? The social-ecological and social-cognitive models. In regards to the social-ecological model, our goal is to partner with the women and the residents of Holmes County on an interpersonal and community level through providing one-on-one consultation with the nurse practitioner, the social worker, and program director, and through involving the community in every aspect of the program. In regards to the social cognitive model, the mobile health clinic will provide the skills, knowledge, and expertise needed to have healthy babies and develop an environment where peers influence behavior change and ultimately helping the community sustain our intervention.
Okay, so how do we know that our Winnebago really brought us a win? How do we know that our intervention truly had an effect? So to do this, we're going to utilize a quasi-experimental design, which is going to allow for a comparison group specifically with our outcome measures. But first we want to look at what are indicators of proper implementation. So to do this, we're going to look at patient satisfaction surveys as well as gathering data qualitatively through focus groups to really ensure that women are satisfied with the care they're receiving, that it's culturally competent, that they have good relationships with their providers, things of that nature. And then we want to move on to what are really those short-term indicators. So what are those changes in attitudes, knowledge, behavior? So to do that, we want to look at pre and post surveys in terms of looking at women's knowledge due to the education that they received with the program director. But we also want to look at patient medical records. We want to look at rates of high-risk referrals, and we also want to look at increasing insurance status in terms of that affordability piece. Okay, so then we want to look at, does our intervention really achieve its goal? What were those long-term effects of it? So to do that, we're going to look at indicators both within our patient population as well as our comparison group of Boulevard County, which is similar to Holmes in terms of infant mortality and environmental barriers. So our indicators, we're looking at our early and adequate prenatal care, 0 infant deaths within our patient population, as well as an overall decrease in the infant mortality rate. And so to do that, we're going to utilize patient medical records as well as birth certificate and death certificate data to look at those indicators.
So come, join us, and grab your party hats and help us celebrate babies' first birthdays.